Started. I think we're got everything set up, and I still see a few folks are kind of getting logged in. So what I wanted to start off and just say thanks to everyone for all of the efforts underway to start off the new year. I know many of you are started already, or if not, will be possibly yet this week, and appreciate the work that's going on. I think I can probably tell a little bit from even our participant numbers here today that maybe this next idea anyway is a good one, in the sense that we're kind of talking about maybe adjusting what our biweekly future calls may be, so it's maybe less of a live event and more of something that we can share with you in other updates. As I know it's going to be tougher as the school year proceeds to make any particular point in time work well for everyone. So we're going to give that a little bit more thought and look at how we adjust for that going forward. And realistically, I think what I do want to, I guess, recommend to folks is that certainly stay close to the conversations and the content, and obviously if there are challenges that you're meeting that you need some assistance with to think through, or otherwise, please feel free to reach out directly to me, to any of the staff at the Department of Education, and as always, we'll try to do our best to help you out on those fronts. So with that, I kind of thought I'd start out with a little bit of the message around, I know a couple weeks ago I shared some of these underlying foundational values for our work, and shared them in a letter to you, which I was really hoping would be just important to kind of begin the new year with these underlying values, and that we want to be able to focus on equity, obviously, as we start this new year. And we know that this pandemic has probably hurt our underserved students and families the most, and obviously all of you from a school level are such an important part of that strategy to address those inequities. And so I thank you for that work. I think it's important that even as we do this, that we think of the highest levels of quality, that we can continue to think about how to do that. Obviously challenging times, but again, thinking about those best practices and learning through the school year is really important. And I guess this is as much of a promise, but also something that I hope you're able to do, is just ensuring flexibility from the agency is my hope, and also that trying to be flexible with the students and families, as we're likely to see, and staff too, by the way. We're likely to see a whole set of challenges that we're already running into. And then underlying all of this is the importance of safety has been critical, and again, being really ongoing thoughtfulness about that. We're learning as we go too about making the environment safer and safer, the importance of us supporting one another in those environments, and again, making sure that folks feel safe in their environments that they're in. And then ultimately this end point anyway around decisiveness. And obviously we make decisions that are not always going to be right. As soon as we know that it's not right, being also decisive about adjusting and being adaptable to the types of things that we have to do going forward. And so I know your communities, your staff, your students, your families are all looking to you to make those decisions. And again, I just want to highlight how appreciative I am of that ongoing work that you're doing across the state. So ultimately, I want to make sure that we're highlighting these things, and we really do support you, and as you've kind of built your plans, that you're thoughtful about the underlying science and the healthcare community, and working with your public health officials, really driving this approach as best possible. And ultimately, everyone's goals is to be in person as it's appropriate for the communities, but the balancing acts that we're going to have to do is still there, and we're going to try to support everyone on those efforts. Obviously, it's always been important to keep your parents and community engaged, and we continue to do that and find the best ways to do that particular work across the state. And so I thank you for that. Obviously, we'll continue to support those plans and efforts where we're prioritizing our learners that might need that support the most, our English learners, our students with disabilities, certainly our economically disadvantaged students. And again, that's work that you've been used to and doing, and I encourage you in that work, and really want you to be able to continue to focus on that. And then this focus on accelerated learning, meaning that we know that we've been challenged by losing some time to offer learning and educational experiences, and how we can kind of keep that moving forward, but at the same moment in time to be able to focus on the social emotional needs of our students and staff and families and communities as a whole. And so again, thanks for all of that work. That's what I hope we've been consistent in supporting you on those fronts, and want to continue to do that. So I think the governor's on anyway, and turn it over to the governor for some comments. And I know he can only be with us for about 20 more minutes or so. So thank you, Governor, for joining.
Well, hey, thanks very much, man. I appreciate it. And you really covered a lot of things that I wanted to hit upon as well. So I'll just reiterate it, because you did a good job. First of all, I want to say thanks to everybody on the phone. I know, obviously, these are the most trying of times to navigate through this, because there's no playbook on how to do it, and everybody's going to have a little different take based upon your unique school district. So I just want to say thank you for all your work and all the works of your teams that are working to be able to make sure that our kids can get all the things they get out of school, starting with that education. And I do want to just, play upon some of the themes that the Commissioner was talking about with regard to, how important it is to, make every effort to get kids back into the classrooms, especially kids who are not going to do well in a remote learning environment. I've had parents come up to me from special needs kids saying, hey, that just doesn't, remote learning just doesn't work. And, they're not going to wear masks because that's just not who they are. They just can't do that. So, finding ways to be able to mitigate those things is going to be really critical for, as the Commissioner was talking about, our students that are most at risk. And of course, all the other benefits besides just academic progression that are important to an overall child's well-being, the physical activity, the mental health, the socialization, the nutrition, all these things are important. So I know you're all working very, very hard to be able to make that happen, and I appreciate those efforts. Also want to just reiterate what the Commissioner said with regard to working with your local public health departments. You're the policymakers. You have to make the decisions on this, but those folks can be really, really helpful as you're putting things together. These are just parents and so forth related. Different school policies are going there, and that's why I think it's, to me, that sometimes aren't in sync with what we ought to be doing. So, again, just making sure you're consulting with your public health directors about what it is. One story was relayed to me. It was about a school that was doing everything right, except at lunchtime they were having all 500 kids in the lunchroom at once. With no mask, obviously you can't wear a mask when you're eating, and so that seemed to be problematic. Going one way, and then another direction on a different school was that every kid was going to have to quarantine if one child came down with coronavirus. Which, again, if they're all being masked, that wouldn't necessarily be the case. So that's where I think, again, working with your local public health departments to establish those policies up front before you get your first case, so that everybody kind of knows what those rules are ahead of time. With regard to the state, we're continuing to pursue, the 6 pillars that we have that are supporting our strategy. Testing, Test Nebraska now is making up nearly 60% of all the tests that we're doing here in the state. Last week we did over 30,000 tests, so about 4,300 tests a day, which is, continuing to increase as we look at expanding our capacity in the Test Nebraska lab, so that we have the availability to do that testing. And we're working to drive down the turnaround times on that as quickly as possible, and looking for new ways to be able to do that as well, so that we can quickly turn tests around should you need it, to be able to find out if somebody was indeed, positive, and having them isolate, or the people that may be isolating before somebody gets a test, or quarantine before somebody gets a test back, so that if the person turns out to be negative, they can get back to work or whatever it would be. So we're working on that aspect of it. Contact tracing, we are transitioning between Emeritus as one of our providers to Nelnet. And so we have a slight drop off in the number of trained contact tracers in the state, down from 1,002 to 972, but that number will be bouncing back up again as we get the folks from Nelnet trained up and back on board. And currently right now with the demand we have, we're only using about 400 contact tracers right now. But again, we want to have that robust capability so that we can get to people as quickly as possible. Right now, we're people who test positive. We're making outreach to them. About 95% of them we're reaching out to on the first day that we get that test result back, and we're getting about 45% of the people to actually pick up. So we're making contact with about 45% of those folks, and then we're getting to their contacts, those people that have a close association with the person who tested positive. The average time of getting back to them is less than a day. So again, generally, we're getting to those folks on the first day as well. So that's one of the reasons why we want to have this robust contacting capacity, is to be able to make sure we can reach out very quickly. And that testing and contact tracing, again, that's the bread and butter of how you control these types of viruses. And then, of course, we're continuing to work the issue with regard to the quarantine space, ordering more PPE. We have been hearing concerns about some of the supplies being available, so we're working to order those up ahead of time to make sure we've got robust capacity there. One issue I do want to clarify is that many of the healthcare providers and so forth would prefer the N95 mask versus the KN95 mask. And we certainly understand that desire. There just is not the availability of N95 masks out there in the marketplace. And so the FDA and the CDC has approved certain vendors of KN95 masks, which are the only vendors we use, to be able to distribute that. And we do have a contract with Honeywell to start delivering N95 masks this month. So we will start replacing some of those KN95 masks with the N95 masks, but that availability is just not out there. So if you do hear something about that, we are working to make sure we've got that robust capacity around that. And then we also are just continuing to work with regard to different at-risk populations, whether it's our long-term care facilities, our food processing plants and so forth, to be able to make sure they've got the appropriate plans in place to be able to, slow the spread when you've got congregate. And of course, you all are doing that with the local public health departments for the same reason. When you have a concentration of people, at the end of the day, it's about person-to-person contact. So, again, if you avoid those, when we're out in public, if you're avoiding, being closer than 6 feet to people, wearing a mask, washing your hands, those are all things that are going to help us be able to continue to control the spread of the virus. And then with our directed health measures, again, we're in phase 3 across most of the state. We do have 3 public health departments, Loop Basin, North Central, and Southwest, which are in phase 4. But other than those, everybody has been at the same level since June 22nd, which limits some of the capacity on those gatherings and so forth. And we will, again, at the request of the public health departments, really be in that through the rest of August. So we won't really be considering loosening up those phase 3 restrictions until we get in September. And frankly, again, a lot of that will depend on just how well it's going with regard to our schools and how our public health department folks feel about how that's coming along. So there's a lot we don't know. We certainly understand that. We're all kind of learning together on this. But again, that's where I think just continue to have good lines of communication and continue to work back and forth is where we're going to be successful. We did have Dr. Deborah Burks here last week. She mentioned that Nebraska is making progress, and we're going to continue to work with her office with regard to the things we can do to be able to slow the spread of the virus here in our state. So we had a nice visit with her on that, and she gave us some ideas on how we can increase our testing even more. So we'll be pursuing that and continue to work with the federal government on their ideas and how we can go. She was actually very positive about the opportunity for a vaccine, which is good news to hear from somebody who has got way more information than I do, for her to come in and be so optimistic. Now, having said that, it is going to be probably next year before we see these vaccines, January to March timeframe before they start coming online. So we do have to be looking toward managing this through at least the end of the year. And then, there'll be priorities for the vaccines for next year as well. So it's not like everybody in the country is going to get it all at once. And so those more at-risk populations will probably be getting the vaccine first. So those plans are still being developed right now, but that's kind of where we're heading with regard to that. And again, just want to continue to keep focusing on all of our non-pharmaceutical interventions to slow the spread of the virus here. So thanks again to everybody who's been working on this. We really appreciate all your hard effort as we talk about how we can make sure that we're getting our kids back in classrooms and keeping them healthy. It's like I said, I know it's a tough road to hoe because there is no playbook for this, and every school is going to be different, but we appreciate all the efforts you're making. And with that, Commissioner, I will turn it back over to you.
Yeah, and thanks, Governor. And just kind of to highlight a little bit, I mean, and I appreciate the, partnership we've had on these things. Appreciate just whenever something's popping up that you're able to give me a ring, and I thank you for that. I know one of the things as we start to see this with, and we will have cases that appear in school. We've obviously already experienced some of that, and we'll keep working with you and your team to move those things forward and work with public health as well, and just appreciate that very much. So thanks for that.
It's my pleasure.
I think I'm going to have Lane Carr join a little bit to talk about some of the roles and responsibilities for safely opening schools. And this actually goes to some points the governor was making about the importance of working with our local public health folks. I know we probably hit you up with this before, but I think it's just good as a reminder of kind of the protocols we have in place. And I think, again, as there is no playbook, but I think this is the strongest hand we have to work together on these different roles. So Lane, I'll turn it over to you to kind of walk through this a little bit with folks.
Great. Thanks, Commissioner. And yeah, you said it a couple of weeks ago during one of your press conferences with the governor about these roles. We knew from the very get-go that having clarity around these roles was absolutely critical. So I wanted to just spend just a quick second talking about kind of what we vision the role and some of the next steps for each of these players in this work. And we know that we're always stronger together, and we've been lucky to have such partners at the table. So with our local public health departments, we've been relying so much on them to really help communicate and develop the localized risk dial. So consulting with the superintendents, consistently having a protocol in place, and then working really closely with schools when there are cases within the school walls, or when we know that there's been close contacts, right? When we look at our school districts or our non-publics, it's really the opposite, right? Ensuring that there's a consistent and clear line of communication with the health department, really thinking about how you're communicating those plans, working with local public health, working with all of your stakeholders, your teachers, your families, and communicating regularly on what's going on, and just being really transparent with that. And we've provided a lot of hopefully helpful tools out there on our Launch Nebraska website that you can kind of tweak and adapt to your own needs. Been working really closely with the Department of Health and Human Services. They're really the enforcement and monitoring of the statewide data, have that eye, have that glance of, as the governor was saying, where we are in the phases of the DHMs, have that access to federal funding, federal tools. The mass connection is a prime example of that statewide coordinated effort that we're really able to leverage with our partners from the Department of Health and Human Services. On our end, we're really working to help schools be flexible, looking at the regulations that we know may stand in the way, and thinking of the things that the flexibilities that we can allow, as well as the different technical assistance that we can provide. So we've been working really closely with several schools, thinking about these planning protocols, putting out our guidance that all schools can use, and then making sure that the protocols that we do put out are being followed with fidelity. And then the final piece, we've been really lucky, truly lucky to have such a strong organization, such a strong national and international renowned partner like UNMC. And again, they have such connections to the research arm of all of the CDC and the differing public health kinds of connections there. So really leveraging UNMC to provide that consultation and high-level policy support, thinking about risk analysis and technical assistance to schools as well as to our local health departments. So again, just really thankful for all of these different roles as we kind of look into what we can support and how we can support as we go into the year. So if you can go to the next slide, we're going to kind of start some discussion about the things that we have on NDE's webpage. And I will kick us off by just sharing that we've added a couple of things to the Launch Nebraska homepage, including some considerations for school meals. The governor mentioned that there were some issues perhaps with the lunchroom, the cafeteria, and ensuring that that's safe and productive, as well as following the same protocols that are present in our classrooms. So you can find information there. You'll see some very specific guidance then in 3 areas. One is around health and PE, where we know that there's like just some specific and unique circumstances. You'll also see that for fine arts, which is right down below that. And then finally, we have some very specific guidance around career and technical education, thinking again specifically about the equipment, et cetera. So just invite you to check those things out. And, this is mostly a reminder as we kind of go into this conversation with Dr. Vargas and Dr. Epler around planning. This idea of the leveled guidance, right? Our goal is that if we do our job and if our communities do our job, we'll hopefully start to see that risk dial start to move down towards the green. But we have to consistently analyze that risk and identify the protocols that we have in place. So with that, I want to turn it over to Dr. Vargas and Dr. Epler to talk a little bit about some of the planning and some of the supports that they have in place. So I think I'll turn it over to Shirley first.
Thanks, Lane. Good afternoon, everyone. First, I want to just say thank you all for joining us. And while you may have already seen some of these slides prior, I definitely want to just say that this can be used as a way to reassess and make any adjustments necessary to the plans you may already have in place. And we start with the phases of the planning work, really thinking about, what were some of the priorities that you may have set? What were some of the visions that you've identified that you wanted to see come to life throughout this school year? Then moving into what can schedules look like? And then lastly, ensuring that you have professional development for your teachers and leaders, as well as any other things that you might need. Currently, I just put in the chat, I just ask that you make a copy of this document before you move forward with it. But if we go on to the next slide, we'll see that I've actually taken a few screenshots, but of this document that we were able to create in partnership with instruction partners who, like Lane mentioned earlier, had been working with a few of our school districts to provide some of this tangible support around reentry planning or scenario planning. And I want to highlight in this first component right here is priorities, right? And understanding that we may have already identified prioritized groups of students, and it's also okay that based on whatever data you might have, based on the current need you might have, knowing that things change so rapidly, you may have to reprioritize groups. Right. And what we also want to make sure we underscore is that, the support that's provided in person, right? I think some of the examples that have already been provided is critical, right? So understanding that students with disabilities may require that in-person support, English learners requiring English language development, students without adequate access to technology, our youngest students, right, who we know may have some more difficulty managing technology. And then lastly, students are transitioning into like really pivotal grades, either into middle school or high school. And then for the next piece we have is also thinking about, well, what does this mean? If we've already planned, we've already made these plans, can we adjust them? Should we adjust them? And absolutely, right? Continue to have a continuous improvement process in mind, right? So based on the data that you have and based on whatever risk dial you may be according to your county, you may want to consider, right, these different pieces. So if you're in fact in phase 3, this is what, the health measures will look like. These are the protocols you'll have in place. And then what does it look like for schedules for your K2, your 3-5, 6-8, 9-12? And then the second piece I want to draw your attention to is around measuring attendance, or really just how are we measuring connectivity? How are we measuring contact? How are we measuring engagement? And how are we measuring participation? So that we have a more diverse and open perspective to how we're keeping contact with some of our students. And I highlight some resources here. The first is around a recent document that came out. It's in the form of an FAQ around student attendance and flexibility. And then the others around student, family, and community engagement and how we're staying connected with families, if in fact they're remote or whether or not they're actually in person or a hybrid. And then lastly is also thinking about some of the things that we're seeing. So we're getting a lot of responses or a lot of questions from school and district leaders around, well, how do I pivot from whatever instruction we had in the spring to ensure that we have a strong continuity of learning for the fall? And it starts with having some common instructional materials and also assessments that can go throughout a variety of scenarios. And I know that Dr. Epler would talk a little bit more about this, but I wanted to highlight that here too, is that if we're not also thinking about this in the planning, right, we're missing an opportunity. So really thinking about how can we make sure that, you know, our content areas as well as technology platforms that we're going to use across different grades and different content areas are, you know, thought about and captured here in a way that you and your team can engage in. And then the last thing I'll leave you with is around the professional learning priorities and progress monitoring. So really thinking about, you know, time is of the essence. And if you're going to have your teachers engaging in anything, it should be something that's going to be promoting what's going to be best for the students in front of them. So what will that professional development be? And also for your leaders. And then lastly, how are you going to keep track of all of this, right? So if you're thinking about, well, I have a school improvement plan, I have a framework visit or a cognitive visit, these shouldn't be separate things, but they should all be encompassing and really thinking about how you're tracking all this data and then making adjustments necessary as you move on throughout the year, because we're seeing that flexibility is key. So I'm going to turn it, and by all means, please email me or call me if you have any questions or anything. And I'm going to turn it over to Corey, who will continue to talk about continuity of learning.
Excellent, thanks. Hey everyone, I'm glad to be with you today. Much like Dr. Vargas mentioned, some of the information that I'm sharing has been shared previously and also shared with our curriculum contacts too. I think one of the things that I really wanted to emphasize today relative to the continuity of learning is what we have called our essential content for literacy and mathematics for this next school year. And I also put a link to that resource in the chat box. So because this next school year is going to look so different, there was work done around identifying the essential content for literacy and mathematics. One of the things that I think is important to note is that this essential content is because of the COVID pandemic and should be used for this next school year. We normally wouldn't take this approach. But through that, there are grade level resources that would help your not only your building leaders, but your teachers actually understand what's most essential, because we do anticipate districts having to go between in-person and remote learning, districts that may have to close for 4 or 5 to 10 days, let's say. So really being able to identify what's most essential for literacy and math. I will mention too that we're recommending that those that particular content be prioritized for in-person instruction in hybrid models. So if you are in a hybrid model, being able to make sure you're able to, if possible, prioritize that for in-person instruction. The other thing you'll notice as you look in that resource is that there is intentional integration of social emotional learning. So we're being very cautious about not separating social emotional learning and supports from the content itself. So that document provides ways that you could be intentional about integrating those supports into the content for literacy and mathematics as well. Dr. Vargas mentioned instructional materials, and I think that's one thing that we're continuing to see is that districts who have high quality materials in place are able to really support coherence and to move more nimbly between remote and in-person learning. Districts who may not have high quality materials in place, I think some are finding that they're actually wanting to move to that, like right now. And we do have some examples of districts who have just of last week are making a shift, whether it's K-5 literacy or K-5 mathematics. And you might ask how they're doing that, and it's with a lot of work and a lot of grace and a lot of patience with their teachers. But that's something that's really important, because as you think about, if you have different teachers across remote and in-person learning, having that common set of materials is absolutely important. So if you have questions around high quality instructional materials and which ones are best aligned for digital or remote delivery, shoot me an email and I can direct you to some places where folks are looking towards. The other thing is I also want to be cautious, even though we're saying, yes, let's really focus on essential content for literacy and mathematics, is also make sure to include all content areas to some degree when planning for the fall. So we don't want to lose opportunities for science or social studies or physical education or career and tech ed. And I know that you all are doing amazing things as you're thinking about how to provide support for all content areas. We're getting a lot of questions around assessment, specifically on the K-3 reading side. Some general thoughts around assessment from our guidance that's on Launch Nebraska is to, number one, prioritize assessments that are closest to instruction. And what really is critically important this time is to use those classroom-based assessments to accelerate student learning and really to ensure that there's an emphasis of grade level content. I think that's one concern that I have had, is that we may not have grade level content, but you should really focus and ensure there is that content. Our guidance, you can see on the screen that is on Launch Nebraska. We really wanted to try to make it actionable, so you'll notice that there's a lot of tools and resources available, and they're also in Word, so you can download and put your plan in place according to that guidance. A couple of things that I wanted to draw your attention to on remote learning on the next slide is some specific examples, and I shared this with Curriculum Contacts about 2 weeks ago. So I pulled out some very specific places where our guidance talks about what remote learning should look like. There is also recommendations for what that looks like for students with disabilities and English learners as well. Also, there's an appendix that helps you align your materials to remote and hybrid scenarios. So for some of you that are in a hybrid situation, or you may have to make the shift to a hybrid or remote, please take a look at these specific resources, because they really give you a strong starting point as you're making some of those transitions and having to make them pretty quickly. The last thing I'll mention is that in addition to all of this, and Dr. Vargas mentioned this as well, is on the Launch Nebraska under instruction, is there is a resource around student, family, and community engagement. So we saw a lot of work done this summer to get feedback from our families and our communities, and that drove the development of plans, but we also have an additional resource that's up there as well. And I'm not sure who I'm kicking it to over here. Lane, is this back to you?
This is not me. I think we're back to Shirley.
Well, I'm happy to talk about it too. So, and I really appreciate Shirley calling out those specific examples of priorities, because I think that's something that is going to be really important as districts may be forced to shift between in-person to remote or even hybrid learning, but really being able to identify clearly, are your priorities K-3? And if you can get K-3 in person, does that mean, you know, that 7-12 will be remote? And then planning for multiple scenarios and really defining those is something that's absolutely critical. And I will say the steps that are on the screen are in the Google Doc that Shirley shared earlier that have been really helpful as we've done some targeted work with districts. So again, if you have questions about the prioritization or supports, shoot us an email. We're glad to help. I think on this one, I'm turning it to Dean, Dr. Folkers.
Thank you, Dr. Epler. Greetings. It is indeed a pleasure to be with you today, and I think ultimately there's going to be time before the proverbial bell rings for me to share a little bit of an update on where we are with some of the resources. So thank you for all that were involved in the summer activity of creating and submitting the digital learning profile and plans. Primarily, the information from those profile and plans allowed us to do some prioritization of work and think through strategies of how we can utilize the GEAR resources that the governor has earmarked for closing the digital gap, as well as then thinking through what is the process that we can most effectively work to move these particular pieces forward. So some interesting facts. I mean, ultimately, we knew last fall that there were 142,000 students in the public school side that didn't have access to a device. What we found out, at least from those that submitted a digital learning profile and plan that included non-public, that number had been reduced to 30,000 students. So suddenly the gap, if you will, from access to devices was significantly reduced because of all of the efforts that had occurred and the work that had been happening as a part of the spring's efforts. So that being said, ultimately, a big chunk of those resources from the gear side that were provided and prioritized by the governor are focused on providing devices and closing that gap, as well as ensuring opportunities related to broadband access and the provider information. And so we have been working with a group of folks from the Educational Service Unit Coordinating Council, as well as leaders from the Network Nebraska, other vendor partners, and other ESU leaders and districts to help us think through what makes the most sense and how we can best affect and implement aspects of those resources. So we're hoping by this Friday, that would be the end of the week, we'll have clarity around the guidance and process to acquire or close that gap with regard to the devices, and then information about opportunities related to broadband access and supports that are occurring within the state. So those details will be coming by this Friday, and so we should have clarity around what that looks like and how we can move forward. So appreciate the patience and the insights that all of you have been providing as a part of this process. So the last thing that I wanted to give an update on is related to September being Digital Equity Month. And this is an opportunity that started this summer trying to get our arms wrapped around what are the specific needs for students at home and their internet access. Historically, this has been the homework gap, but ultimately in the context of COVID and all of the experiences with regard to the pandemic, it has taken on a different meaning in that access from a digital perspective with broadband is highly important in order to ensure connectivity. And so a part of the fall data collection process and the transformation piece of that puzzle was providing districts an opportunity to capture that information related to students' quality and accessibility to home internet access. We have been working with the National Education Superhighway Group and the Council of Chief State School Officers, who have created a digital equity guidance. And as a part of that work, have provided a protocol and some consistent metrics and measures related to capturing this information that can be used to then identify and partner with vendors, internet service provider vendors, wireless providers, but it can also be used to help us target the resources for other supports in providing regional coverage for equity of access, digital equity of access. And so the month of September is identified as the Digital Equity Month. We'll be sending more information about opportunities, webinars, engagement, resources that will help support this very important part of the connectivity of the work that we have moving forward. So with that, that's all that I have, Commissioner or Lane. Thank you. Let us know if you have additional questions, but be on the lookout for some guidance toward the end of the week.
All right, thanks, Dean. And the school bell didn't ring on you, so I'll kind of put us in a position where I think we can wrap up. Hey, I did see questions, and I'll try to address it here quickly on teacher certification. We're still backed up on some of those particular fronts, but there are a couple different methods in which I recommend folks, if they, especially the first year teachers, that if you feel backed up on that, I encourage you to reach out to Brad Dirksen, and it's well, maybe I know you can find it on our website anyway. But you can go ahead and email brad.dirksen@nebraska.gov for some of that. I'll try to put it in the Q&A before I leave. Oh, I see Lane just did. So also I think the kind of the next steps for us will make some decisions about how the processes might go as far as cleaning up the remainder of teacher certification. If you are having renewals with teachers that are currently working, and I think we tried to prioritize the new teacher certificates, and then there's another process again that I think you can find on our website about how to manage through that environment. So we'll keep working on that. I appreciate your patience, and again, we'll kind of keep plugging away. So you're welcome to email me or Brad Dirksen on those particular fronts. And then kind of last, as we kind of change up maybe what our strategies are to kind of keep folks informed, we're probably down maybe a couple hundred people from maybe what at least our high was, or even, well, probably not even a little more than that. But we'll come up with some other strategies, as I know the school year kicking in is going to make people's availability for this on a biweekly basis even difficult. So again, keep working on that. We'll keep trying to message, use our website, obviously is listed there on the wrap up. As we've discussed, we'll keep working with the set of partners that we have. We have some challenges that we haven't yet probably met. So we'll take those on, and always anxious to hear how things are going or not going well, or going well either way. And we'll try to hang in there with you. So thanks for the hard work you've done. Thanks for, kind of being ready to be adaptive as necessary, and appreciate again, just your leadership and education across the state. So take care, everyone, and we'll figure out what our next phase of presentation is. But thanks a lot for everyone's attention.